Hello and welcome to this edition of EC3 HOSA Medical Moments. During the past 2.5 years that we've been in COVID lockdown and COVID issues, we've been joined many times by Terry Bergen, and Terry works with our local Lincoln Trail Health Department in the area. And as a district, Terry, for those of you at home that may not have heard about Terry or know who she is or what she does, just for our viewing audience, tell us a little bit about yourself.
So I am during COVID, I'm the Public Information Officer for Lincoln Trail District Health Department. That's my primary role right now. Non-COVID, I'm the Health Promotion Manager. So anything to do with community health strategist or AKA health education usually falls under my role.
Now, and what's the service area for the health department?
We cover 6 counties. So we're in Hardin, LaRue, Marion, Meade, Nelson, and Washington. And
for that large number of counties, how many employees do you have?
We have about 80-something employees that cover a population of over 200,000 individuals.
And they don't just cover COVID.
No. Although that is our primary role right now, you know, we had to limit our services that we provide at the health department in order to switch over into COVID mitigation mode. And so we still provide WIC. So individuals who are not enrolled in WIC, which is a supplemental food program for women, infant, and children, and may need that extra food, they can still call us and get enrolled in WIC. A lot of those services are provided over the phone. But we are doing COVID vaccination. We're doing COVID, we still contact individuals who've tested positive for COVID. A lot of people may not realize that. But what we have had to do is reprioritize the close contacts. So we don't contact those close contacts anymore. And we no longer provide work releases or return to any type of release, return to school, return to work releases, because the case numbers are so high. And so we had to shift to focus more on confirmation of the cases that were confirmed.
And so basically those organizations or businesses have to take a role in that.
Yes, they really do. Now we recommend that they accept the doctor's note, or those businesses also accept the positive lab, because, you know, once you have that test date, you count 10 days. They're released on the 11th day, and that's the day that they can return to work.
I had mentioned earlier in our pre-conversation that last year I knew a few people that had tested positive, but with this past, let's just talk the last 6 months, it's been much, I mean, I think that I know a lot of individuals. I'm just going to say, I know a lot of individuals who have tested positive, who have gone through COVID, and some have passed from the severity of it too. So why is that trend happening?
Well, you know, with COVID, you know, any virus can mutate, Gina, any virus. So what helps to limit that mutation is vaccination, all right? Or if you've already had COVID. Okay, so we started out with the Alpha variant, and it has mutated over time into the Delta. Every time the virus comes in contact with an unvaccinated person, what happens is that virus can mutate, and sometimes it can be a weaker version of itself, or it can be a stronger version of itself, which is what happened with Delta. Delta is more transmissible. It's contagious, and it is affecting all ages. Whereas with the Alpha, we were really concerned with more of the 65 and older population. They're vaccinated. right? And so what we're seeing is that it is affecting the individuals who are not vaccinated. It is really having an impact. That vaccine really makes a difference. And so we have seen, we receive calls where individuals will call and the mothers had it, the fathers had it, all the children has had it. It is going through families like wildfire. It really is. And if you have someone that's vaccinated in the home, it helps to limit that. It helps to stop that a little bit. If not, and I'm going to tell you, most of the individuals that we talk to, they're not vaccinated. When we look at the new cases across the district, high 80s, low 90s, so 90+% are unvaccinated individuals. So getting vaccinated is so key here.
Terry, you mentioned that in the first wave it was older individuals, health having some health issues, that type of thing. And now, wildfire.
Yes.
So everyone is compromised.
COVID does not discriminate. It really does not. It can affect the very old to the very young. You know, if I could give you some, I have some data here that I want to share with you related to the cases related by age group, okay?
That would be great.
So when we looked at, and this is for Lincoln Trail District Health Department, and this data is of last Thursday, okay? Right. So when we look at the active cases by age group, the highest age group within Lincoln Trail District Health Department is that has COVID right now is between 11 and 19-year-olds.
Wow.
Mm-hmm. And then that goes to the 30 to 39-year-olds. 20 to 29 is the third group. So basically from 11 to 19 to 30 to 39, it's that age group that we have the highest number of cases right now. So it affects all ages. And
we have recently had a young adult to pass from COVID. And so we know that yes, it affects everyone adversely.
Yes.
But it can also, as you said, no discrimination in regards to life or death.
No.
Another trend that you had mentioned before is keeping people safe. Businesses and things are doing their best to keep their customers safe. But you still see a little bit of a backlash against that. Do you work with businesses to help them facilitate putting sanitization and COVID precautions in place or COVID steps in place to keep it clean?
So we have, in the very beginning, businesses reached out to us a lot more than they do now. And so the governor kind of has helped with that too, because of the Healthy at Work guidelines that are now on the kycovid19.ky.gov website. So a lot of the businesses refer to that as far as what they need to put in place and have in place as a minimum requirement. So we rarely, I mean, sometimes we do, but we rarely get calls from businesses related to what they should do. We get calls from businesses related to how long should my employee quarantine? When can they return back to work? Or we may get calls from employees who feel that something is not quite right, the practice is not quite right, and they ask us to check into it. So we receive those kind of phone calls right now more than the what can I do to be in compliance to reduce my chances of COVID in my facility.
Well, and some of them it was like overnight, as soon as things started ramping up, and many kept the same policies in place that they've been doing.
Right, which work. I mean, they really do. If you, it is very wise not to abandon what you were doing last year, 2020. Because COVID is still very much here, as an indication by the rise in cases that we're seeing. We increased, when we look at well, let me start with this. November 2020 was our highest cases when we look at last year, the month. August 2021 exceeded that.
Wow.
So we are still having a lot of cases when we look at last week. Okay.
Which, for those at home, this is being recorded on September 29th, September 28th.
So cases diagnosed in the Lincoln Trail District area increased by 1,397 last week. But I have to add a little caveat to that, Gina. We are seeing a slight decline, all right, which is good news. But the cases that we're seeing now is still higher than we saw this time last year, even with the decline. Mm-hmm. So we still need to continue to do those things that will keep each other safe.
If an individual has had COVID,
yes,
when can they get vaccinated?
All right, so it depends. It really does. If you had COVID and you didn't go to the hospital and you didn't get any type of treatment for COVID, and what I mean by that is that you didn't receive any type of monoclonal antibodies or anything that was given to you by your provider to reduce the chances of you getting worse or the disease being more severe. If you did not do that, then as soon as you're out of isolation, you can get vaccinated. If you did receive any type of treatment, then you have to wait at least 90 days.
Are you seeing an uptick in vaccinations in the area?
Mm-hmm. So slowly but surely, our vaccination rates are increasing. You know, we would like to see more people get vaccinated always. We like to do that 80 to 90%. The governor said 90+%, so that we could achieve that herd immunity. Unfortunately, what I think we're doing is, because everybody is getting COVID, we're achieving herd immunity the hard way. You know, this is a way to do it, but it's tough. Some people make it out of that, some people don't. It is better to just get the vaccine and reduce your chances of getting COVID that way than actually coming down with the disease and building antibodies that way. Yeah.
Well, and it helps if someone gets the vaccination, they've had COVID before, they get the vaccination, if they're around others that have COVID, it just protects them in the long run.
It really does. It really does. And some individuals think that because I've had COVID, I don't need to get vaccinated. And what we know for sure, because the data says this, is that individuals who have COVID, their immunity wanes over time, okay? And so having that vaccine kind of helped boost that immunity level back up. So it does not protect you forever. Getting COVID does not provide you with lifelong immunity. It is really recommended that after you've had COVID that you get your vaccine.
Where are we at with the boosters?
Well, as far as Lincoln Trail District Health Department is concerned, we're still waiting for guidance from the Kentucky Department of Health on how we will proceed. But there are some local pharmacies that are providing boosters already, or that third dose, and there is a difference. And you should check with those local pharmacies in your area.
Or check with your doctor.
Or check with your doctor. That's exactly right.
They should be. Okay. Is there anything that we haven't discussed, Terry, that you'd like to
Yes,
mention?
I would. There's one more thing I'd like to discuss. Thank you, Gina. We've been receiving a lot of calls from individuals who, for example, a household member tested positive for COVID. Okay, and then for whatever reason, they test positive for COVID. And so a lot of individuals think that they have to extend their isolation time because another member in their household has tested positive, and that's not the case. So for example, if you test positive for COVID, then your husband tests positive, you still are released on the date that was given to you by the health department. 10 days of full isolation, released on the 11th day. You do not have to re-isolate because someone else in your household got COVID. Okay?
Great. I know that I just want to say that I applaud the Lincoln Trail District Health Department. You all have gone above and beyond. And thank you for all your service and everything like that. If individuals would like to have more information, I know about your website and phone numbers.
Yes. So we added a isolation calculator on our website.
Oh, wonderful.
So if you have questions about when you should return to work, just go to ltdhd.org, which stands for Lincoln Trail District Health Department, ltdhd.org. You're going to click on that little green button top left. It'll take you to our COVID page, and you'll see the calculator there. Or you can just link directly to it because the calculator button is on the home page as well.
Wonderful. Thank you, Terry, and stay safe, stay healthy, and keep up the great work.
Thank you.
This is a second part of EC3 HOSA Medical Moments, and joining us is Janae Sutton, and she is director of our Family Youth Service Centers and also our Health and Welfare Director. I know that's many more titles, but Janae, just let people know what your job role is.
Yes. Good morning, Gina. I'm Janae Sutton. I'm the Director of Health and Family Services for Hardin County Schools. I'm serving in my 25th year with Hardin County Schools and my 10th year within this role. Primary role, I am the Family Resource Youth Service Center district contact, for all those individuals who are working in the buildings, our FRISC coordinators and our outreach workers and cradle school and so forth that assist families to remove barriers for their children so that they can be successful within the classroom. And then my other role is I'm the liaison with Cumberland Family Medical with the Lincoln Trail District Health Department, our community partners such as Baptist Health, and our local physicians as we work to keep our students and staff healthy and safe within the school building.
Now, recently, and things do change day by day, the Hardin County Schools District has come up with some new documents that parents are going to be made aware of. And so can you review those items for us as they stand today, which is September 30th, 2021?
Yes, Gina. We have seen somewhat of a roller coaster as we follow the pandemic over the past. It's been a little over 18 months when all of this began back in March 2020. We began with guidelines that were secured through the CDC as well as our Department of Public Health. And for those of you that don't understand, our Department of Public Health at the state level is the governing body and agency over our local health department, Lincoln Trail District Health. Lincoln Trail District Health Department for many months has helped guide and lead us to make sure we're making secure decisions so that we can keep our families safe. Many of you know that the governor placed certain mandates throughout this pandemic, and based upon the occurrences, whether it is numbers of positive cases, individuals being placed in quarantine, the spread, we then, Gina, went on to the Delta variant and other variants. We've also the ebb and flow of individuals getting vaccinated as well. Many things go into our decisions and so forth. But as of recently, to catch everyone back up, the state legislature turned decisions over to the local school district. We consult with our local health officials and individuals who are practicing medicine within our district. Our superintendent, Teresa Morgan, and myself have worked and talked with those individuals numerous times so that we can make what best decisions there are. Based upon the facts, what we have been doing since August the 12th was our first day of school. And as our first day of school began, there were positive cases. We saw a huge increase in the positive cases within our building. We were charged. The health department simply couldn't keep up with everything. So they do still receive positive cases, but we are providing return dates for those individuals that do not have a return date from their healthcare provider. We are following also now, in addition to direct contacts identified within the school, we are also following all household direct contacts, which leads to a great amount of numbers. Since we have been given that charge by the health department saying that they could not do that, we've had all the numbers, for lack of better words, the statistics. Every single student who has been identified as a direct contact was given, starting in August 12th, a tracking worksheet. That tracking worksheet helped parents. We encouraged them, put it on your refrigerator. So day 0 was their last day of exposure to a positive case. They would be in quarantine in their home. And on day 5, 6, or 7, they could get a rapid test right here with our Cumberland Family Medical folks or with the healthcare provider of their choice. If negative, then they could return on day 8 If they chose not to test, they would return on day 11 after a 10-day isolation period, with the caveat that if at any point during those first several days symptoms arose, then the 7 and 10-day option would not be available. Rather, the 14-day quarantine would need to exist and return on day 15. So that was our quarantine option. Then the state came in and gave us tests to stay. And again, our health department assisted us with protocols and so forth on the test to stay. Test to stay aligns pretty well with the 7-day quarantine of our 7-day regular quarantine. And it is a modified version of quarantine. It's just that when you come in the morning, day 0, again, is your day of exposure. You test day 1, 2, 3, 4, and 5. And after a parent brings you in, or if you're a staff member, you brought yourself in, you report to an area that the school has identified. And in that area, you do test a COVID rapid antigen test. And if negative, you go on in and you have school for the day. If you're a staff member, you work for the day. You are not allowed to participate in those extracurricular contact sports for obvious reasons. After day 5 of another negative test, day 6 and 7, you're still in that modified quarantine, and that you're only allowed to participate in school-related activities and anything that's not contact and so forth. Then day 8, when you return, still no symptoms, you're back to full activities within Hardin County schools, back to your contact sports and so forth like that. So test to stay has been added. So then after collecting data for about 27 school days, we literally went over every single one of our direct contacts. It was around about 3,600 direct contacts. Children losing school time, staff losing time in the classroom, one at a time, whether they were, and they're reported as household or as school related. Our school related contacts that actually became cases were very minimal. And by very minimal, it's about 1.83%. So we felt like that was a number. We talked with our local physicians again, and that is where what I'm going to show you comes about. So our parents, and this is only because of our numbers. This could change if there's something that goes on and we see an uptick in cases significantly again and so forth. So I'm going to show. This is the letter. If you are a parent of a school-related contact, again, if it's household-related contact, this does not apply to you. House-related contacts will still be doing quarantine. If you're a school-related direct contact, you are allowed to select option 1. As we said, we had very minimal students, thousands of hours of instruction in person was being lost to being in quarantine, yet we were seeing very few turn over to be positive cases. And the key to that is we have universal masking. Both the positive case and the direct contact must be masked for this situation. If at any time they're not masked, say cafeteria, contact sports, all those kind of things that you think of that you would not be wearing a mask during, they would not be eligible for this. There must be universal masking. So direct 1 option, there's symptom monitoring. Other school districts in our local health district area have gone to this. We have chosen not just to have parents monitoring symptoms, but we also have what's called a Healthy at School check. Those individuals that are under this option 1 or have selected this, they must report each morning. We're taking temperatures, talking to them, looking cough, new rash, loss of taste or smell. The typical COVID-19 symptoms are what we're looking at. They're to quarantine while not at school, and they may not be part of contact sports, football, soccer, cheer, volleyball, any of those where there's a lot of shared equipment, where the individuals are huddling up together, running in together, and so forth. That's option 2. I shared earlier, test to stay. That is an option if no symptoms are presented, that any time during any of the symptoms are presented, you're immediately placed in quarantine. And that this enumerates, this letter goes back over what I just shared about testing day 1 through 5, still in that modified quarantine, coming to school on 6 and 7, and then day 8 can return to full activities within the school. Our final option is what I went over earlier in our discussion, is the quarantine for 7, 10, and 14 days, and you receive a tracking worksheet from your child's school that will be sent to you so you can help guide that quarantine and when you can safely return to school. Again, this is a parent decision for school-related contacts only, and you must be masked. I do want to mention here at the bottom, if your child or as a staff member you are fully vaccinated, or you have a copy of your test results that are dated within 90 days of the exposure, you are exempt from quarantining pending that you do not have any symptoms. And we did create a flow chart. Again, the very first thing you must adhere to is that it's HCS related contact. You must be properly masked. If so, you have those different options. If unvaccinated, but as I just shared, if you are vaccinated, you would be exempt unless symptoms present themselves, or if at any point symptoms do come about, you must go immediately into quarantine. If you are not properly masked, it is not an option. This new symptom monitoring, you only have the option to quarantine or test to stay. I'm going to stop presuming. So that basically is where we are currently on September the 30th, 2021. And I know, Gina, as we've shared in previous dates, that this could change at any time. We watch every single day. We keep a dashboard that parents can see about active cases. We as a district keep a dashboard of every single contact, that is staff, that is student, that's vaccinated, that's unvaccinated. That becomes a positive case. We are tracking that data, and that is what is driving our decisions. We are maintaining the mask mandate. At that time, we feel that is a key in demonstrating that we have very few direct contacts that are within the HCS school that are masked that become positive cases. We have kept our goal this whole entire time. One, that everyone is kept safe within Hardin County schools and our school sites and our work sites. And number two, that we keep in-person instruction if at all possible. And we believe at this time that we've done that going into fall break. So we are super excited, super thankful to our health partners in the community, to Cumberland Family Medical who have helped us, and to our parents and students. Yesterday I was in one of our district's middle schools, and the students, they're wearing their mask, they're acting appropriately, they're continuing learning, and it's so much better than last school year when we had to do the shutdown and so many students were at home, because that's not where we need our kids. We need them in person within our buildings, learning and engaged.
Great. Thanks again, Janae, for joining me, and you have a pleasant fall break. Of course, when people see this, it'll be after fall break also. We run it the entire month of October. But again, you have done a wonderful job, and I know that my staff really appreciate everything that you've done.
Thank you, Gina. Hardin County Schools is a great team to be a part of, and it's certainly been a team effort with our parents, our staff, and our students, and our medical community. We would not be where we're at today without every one of those parties. Thank you, Gina. Have a great day.
You too. And it's a great way to end Medical Moment. So have a wonderful school year, rest of the school year.